eat right, exercise, and get some testing done, especially either calcium score, which will tell you if there is a blockage there or not. And if there is symptom, tightness, pressure, heaviness, please go see a doctor and get regular physicals and get regular checkups so that you know that what your cholesterol is, what your blood sugar is. You don't want to wait too long and then have a problem.
Hey, thanks for coming back and watching my videos. And today I'm going to talk to Dr. Gangasani. He's a renowned cardiologist in the United States of America. Originally from India, he was educated in India, went to Cardiologist School of Medicine, and he's in Atlanta leading a bigger group called Gwinnett Heart Specialists. Is a part of Gwinnett Medical System. He not only does the practice, at the same time he's a social person, he's a community person, and he is a friend of so many Indian Americans. Like, I can call him and say that I've got a chest pain, and he tells you come over to the office and immediately gets into the treatment. So very, very approachable, personable, wonderful person. So we are sitting in his office today to understand what this heart disease is all about. Why is it the major cause of death in the entire world? So we'll straight get into the interview, and he's going to give us so many tips so that we can definitely get benefit out of this one. Dr. Gangasani, welcome to InnerView, as well as thanks for accepting to be interviewed by me today. Let's get started with the very same question. Why is this heart attack the biggest reason of death in the entire world? You said entire world. I thought it's only United States of America. What do you think?
Yeah, thank you, Viju, for inviting me for this interview. You're exactly right. The most common cause of death in the world is cardiovascular disease. In fact, the next 4 causes of death combined is still less than the heart disease as a cause of death. So we need to get these risk factors taken care of so that we can get the people live longer with a good quality of life.
Okay. So if you stay on the same subject, those who know that we need to take care of the heart, they do take care of it. But what about the common man? If he doesn't know what we eat and what kind of exercise you need to do, then he definitely is prone to these attacks and he has to run to the emergency room. So we didn't have that kind of an education. These days, the awareness is growing, but what about the common man? Do we have a lot of resources? Or the doctors are educating him when he is going for some other causes?
Yeah, I think on a regular basis, once you're 20 years of age, I think it's a good idea to have a regular physicals. So when you go to have a regular physical, they'll get the blood work done. That will give you what your cholesterol is, what your electrolytes are. And then at the same time, doctor will discuss what are the kind of risk factors you have and what you can improve. Now, some of the risk factors you can get better. Some of them are called controllable risk factors. Right. Some of them are not controllable risk factors. Controllable risk factors like hypertension, diabetes, high cholesterol. So those are the kind of things: smoking, exercise, eating right. Those you can be educated, but you need to keep an eye on. I think at present, all the schools have a good health education class where they're trying to improve the risk factors. In fact, I go to schools almost every year to educate them and to take the heart and then talk about what can happen if you have a bad habits. There is data from the studies that even when you're 13 to 17 years of age, you already have a 15% of the people have their thickness of the inner layer of the heart arteries increases at 13 to 17 years of age.
Okay.
So there is no right time to start. You start as early as possible to change the risk factors.
Let's get a little bit into the heart. Can you just tell my viewers the basic structure of the heart, as well as what are the important organs that connect, what are the important nerves that connect to the entire body?
So the heart, as a cardiologist, actually we are called cardiovascular specialists. Okay. So we take care of the heart as well as the blood vessels. Okay. That's why the cardio means heart, vascular means the blood vessels. Right. So this is the heart model where the heart has basically there are 4 chambers of the heart. So right upper chamber, right lower chamber, then left upper chamber and left lower chamber. So apart from the muscle itself, there are valves. This is a tricuspid valve. Okay. That is the mitral valve. And there is a valve, can't see very clearly, there's the aortic valve and there is a pulmonic valve. So heart can get the diseases from the muscles get the disease from the valves, as well as we have an electrical system, which there is somewhere around in this area called a sinoatrial node, that is our pacemaker. So every time heart has to beat, you need to have an electrical impulse.
Okay.
You may have an Olympic athlete's heart, but if there is no beat, your heart is not going to contract. So you have to have an electrical impulse. If my heart stops for 5 seconds, I'm going to pass out. I cannot do anything. Even my heart muscle is great, I can still pass out because my heart is not contracting. So the main reason for the heart attacks is one of these 3 arteries get clogged up. As you can see, this red area is the heart artery. This is called LAD, left anterior descending artery. This is the circumflex artery, and this is the right coronary artery. So when plaque forms within any of these blood vessels, so that part of the heart muscle is not going to get enough blood flow. That causes the chest pain, and if it's 100% blocked, that's what causes a heart attack. The one thing about sudden death, when somebody gets a heart attack, if there is a blockage in this part of the heart vessels, if you see this is LAD, that is proximal LAD. For some reason, when that is 100% blocked, people die because of a ventricular fibrillation. In fact, that's called a widowmaker lesion or widowmaker artery. So if you have a blockage in that area, the chance of sudden death is a lot higher.
Exactly. See, a person looks very healthy. He goes to work and he's happy and healthy, take care of the family. But suddenly he gets a heart attack. What do you think is the reason? So he may have gone to the physicals. Doesn't he know that something is happening to him?
That's an excellent question. So most people think that they need to have a 70 or 80% blockage to have a heart attack.
Okay.
That's not true. I think most people misunderstand that you need to have that much of a blockage. So there are 2 ways heart attacks or blockages can cause the problems. So there is a 20%, 30% blockage. So that slowly gets more and more, 40, 50, 60, 70%.
Right.
Until the blockage becomes 70% or more, people don't get any symptoms. So when it gets to 80, 90%, if you walk or if you do something, exertion-related chest pain, shortness of breath, that's called angina. That's not a heart attack. So you only get the pain when you walk. You stop, it goes away. That's not a heart attack. That tells us that that heart muscle is not getting enough blood flow when you're exercising. So when you sit down, it goes away because our heart has a capacity to increase the blood flow 5 times more than what it normally can do at rest. So until that becomes 70% or more, you don't have any problem, you don't get any symptom. Okay, so then becomes 80%, 90%. So that gets the exertion-related increase in the symptoms. So you go less distance before you get the symptom: tightness, heaviness, pressure. That is the one way you can get the chest pain or shortness of breath. But that's not a heart attack. You may have a 99% blockage. Your heart muscle still gets enough blood flow when you're resting. It doesn't cause a problem. But the question you asked about the sudden death or having a heart attack. So that people may have a 20%, 30% blockage, but the plaque ruptures. The rupture causes the blood clot. That happens within 5 minutes. So even if I did an angiogram 1 day before, 2 days before, and I have incidences I've seen that people had a 20% blockage, no problem. We said, okay, eat right, exercise, and take some aspirin and the cholesterol medication. Now they came back within a week with a heart attack. We went back and looked at the artery and said, what happened? This was nothing 1 week ago. And that 20% blockage, plaque ruptured, found the blood clot. Blood clot is what causes the heart attack. So it goes from 20% to 100% within 5 minutes. So when that person, two days ago, 1 day ago, 1 hour ago, he was fine. He didn't have any problem. So that is so once it happens within 5 minutes, and you see some people die in the sleep, right?
Exactly.
So that's because the plaque ruptured and it went into fibrillation within 2-3 minutes. If that area with the LAD was the problem, they went into fibrillation, they never woke up because they went to cardiac arrest and heart stopped. If our brain doesn't get enough blood for 5 seconds to 6 seconds, you pass out. After 20 minutes, the brain dies. So there's nothing you can do about it. So from a heart muscle point of view, heart muscle starts to die about 20 minutes. So after 20 minutes, if you have a continuous pain, that means it could be a heart attack. So angina is like it comes and goes. But if you have a substernal, just pressure, heaviness, tightness going into the arm, going into the jaw, not going away, or having sweating, nausea, vomiting, all those are signs that indications that heart is not getting enough blood flow. In fact, I'll tell you, anytime body is telling you that you are getting the sweating, body is telling you something is going wrong. Please go see the doctor.
I have a personal question. How about this? Do you think this is going to cause any problems?
Central obesity is one of the major risk factors, and that's one of the reasons why South Asians have a significant amount of increase in insulin resistance, increases the hypertension, increases the diabetes.
I've seen more obese people than me. I think if you take a 1 to 10 scale, I'm only at 2. I'm talking about heavy weights. Like they look healthy and happy.
Yeah, it's not just the weight. It's the central obesity.
Okay.
The abdominal fat has a lot higher risk of developing the insulin resistance.
Okay.
So I know whenever we look at, if you go to a vacation, if you gain 5 pounds, 4 pounds will go there.
Exactly.
1 pound will go anywhere else. And the other side of the coin is when you lose 5 pounds, only 1 pound goes from there. 5 pounds, 4 pounds will go everywhere else. So it's so easy to get, so hard to lose. You have to work harder to lose those extra 4 pounds. But there is a direct relation between the abdominal obesity and the heart disease.
Okay. Now, a sensitive question, a very important question. Like, how much of these psychological situations, for example, there is a sudden bad news you heard, or some family issues, major, or the business loss, how much of those impact the heart as an organ? Well, it impacts heart as well as mind and everything, like the whole body gets impacted. But since we are talking about only the heart, so how much of it impacts the functioning of the heart?
That's a good question. So the stress causes the plaque rupture. So as I said before, the plaque is what the problem is, but it may be 20%. It's not causing any problem.
Plaque as in the same plaque that we
the
say?
cholesterol.
Cholesterol.
The
Okay.
cholesterol plaque within the blood vessel.
Okay.
So when the blood vessel plaque gets ruptured, that's when you get a blood clot because of the platelets come in. So there are 2 things going to happen: atherogenic, which is the plaque formation; thrombogenic, that means the clot is forming. So with the stressful events, you have a higher chance of plaque rupture. So that can cause a plaque rupture, blood clot formation, and that causes a heart attack.
Please tell our viewers 3 or 4 biggest tips, or the most important tips that you can give.
So one is the prevention. So the risk factors like hypertension, diabetes, high cholesterol, those are, if you have it, take care of them.
Okay.
Take your medications. Number 2, eat right most of the time. So I think even the little changes in your lifestyle goes a long way. And exercise on a regular basis. Fried foods
Should be avoided.
should
Okay.
be avoided. Oily foods should be avoided.
Okay.
Oily. So
If
saturated
you
fats.
say that fried food should be avoided, I get a heart attack.
What do you mean?
I mean, come on, without
That causes stress
fried
to
food-
you.
Yeah, it's so stressful. I cannot do that. Anyway, keep going.
So there are those from a prevention point of view. So treatment point of view, if you get a symptom, anytime if you're getting chest tightness,
Right.
pressure, heaviness, shortness of breath, especially with exertion, or if you have an associated shortness of breath, sweating, nausea, go see the doctor sooner than later. And then learn the CPR, a basic BLS or a CPR, so that if there is a loved one or somebody at the office, if they get into a situation, as I said, within 2 minutes, the brain starts to die too. So if you do the CPR, sooner you do it, the heart starts to get pump the blood to the brain so that the brain can survive longer. So I've seen people surviving 25-30 minutes because the CPR was so good. So until the 911 person comes in so that they can get a shock, most of the time somebody is in ventricular fibrillation, you get a shock, you come back. I've seen even younger people coming back after 30 minutes, but the brain is dead. There's nothing you can do about it. Even though heart is back, but the brain is dead. So that is the reason why when you do the CPR, when there's a good CPR, when you're perfusing the brain, you can prolong the brain death a lot longer. So the chance of survival will be a lot higher when they come back.
Speaking of CPR, if you don't administer the CPR very well, is there a chance of the person dying versus the chance of surviving if he has not done it?
So I would rather do some CPR than no CPR.
Okay.
Definitely there's going to be some benefit of just pressing on the chest. That will give some oxygenation to the brain.
Okay.
Definitely some CPR is better than no CPR.
Nobody can go wrong with
Yeah,
doing that.
nobody, even if you don't know it, just to try to just press in the sternal area just as much as you can. You may be doing wrong, but at least you're providing some blood supply to the brain.
Coming to again back to the heart, the image that you're showing, the relation between the mind and the heart. I would like to know that. We always talk about, you touched my heart. We always think with brain. So tell me how they really communicate, what kind of communication they do when in times of good things and the bad things, or when you are really making a decision, what relation these two have? Both are organs, right? Both are organs.
Both are organs, both are dependent on the hormones.
Okay.
Okay, so the way it works is if you're feeling good, your good hormones, go higher. You become like endorphins, what you call, in the brain released. So those will get your adrenaline, noradrenaline flow a lot more nicer, so that you won't get the heart going too fast. If you're increased stress, it increases your heart rate to go faster.
Right.
So heart rate goes faster. That means you're getting more demand from the heart to pump more,
right,
because your heart is working harder.
Right.
So that can affect the blood flow as well as the arrhythmias. And the other way, when you calm down, your blood pressure goes down. When you're under increased stress, your blood pressure goes higher. That means the blood pressure, if the blood pressure goes higher, this is the aorta, the pressure is a lot higher. The heart has to pump. When the heart has to pump, it has to pump against the higher resistance. So it only can do so long. So you got to take care of the blood pressure so that you're not putting more workload on the heart.
Right.
So when you do meditation or yoga, so that will decrease your the blood pressure substantially. So the stress has every part of the body affected one way or the other. But the heart has a lot at stake.
Okay.
From arrhythmia point of view, heart rate point of view, and blood pressure point of view. I think the less stressed you are, the better it is going to be in the long term. And the short term, you can cause a plaque rupture.
A couple of non-clinical questions. Dr. Gangasani has got a big heart, and he helps the community. He's a nice person. Viju, whereas he never donates money, and he's a bad person. For example, for next 5 minutes. So, do you have a different heart than me as an object? Why do people say that?
The bigger heart, that means you're keeping your blood vessels, blood going through.
I mean, I was serious.
Lot
This is serious
smoother,
question. Yeah.
lot smoother, without clotting up as much.
Okay.
See, when you do the good things, when you feel good,
Right.
with your heart will go down.
That's exactly
so
what I
you
was.
can more effectively make use of the heart function. In a this relative sense, if you look at a tennis player,
Right.
they can have a heart rate of 40 and they can work like you or I when we have a heart rate of 60, whatever the blood flow is, because they train themselves so good at a lower rate, they can get the heart to work more effectively or more efficiently. That's what it does to you.
Okay.
And that makes you feel good.
Some rapid fire questions. Okay. Over the period of time, like since the human was, brought into this world, has the structure of the heart changed? Has it changed, or has it remained the same?
Well, minor changes have been happening. So there were, this is the right atrium. There were little organs were there. There is a hole when we are born. It kind of closes down. There is a vestigial organs like an appendix in the abdomen. So there are little valves which will help during the fetus phase of our life. But as you're born, it goes away. So, but some people, they're still there. It's there. So there are minor changes happening.
So coming to the sports, like a lot of people who marathon runners and stuff like that. So at what point they should really stop doing what they are doing? For example, you are taking part in about 5-mile race or 10-mile race running, and does your heart tell you stop it here, or if he goes on and on, I think he'll collapse, right?
Yeah,
because the heartbeat.
Right. Your body will tell you, wait, I think you're getting shortness of breath, feeling dizzy, lightheaded, you're going to feel like you're fainting, don't do it.
Okay.
So most of the time we know what's going wrong. Any exertion related symptom, I think you should go see the doctor.
I'm sure there's a lot of research going on. Tell me, what are the latest findings and latest discoveries that are made to bring down the diseases related to heart?
Lot of research going on in each and every part of the cardiovascular disease.
Right.
From a pacemaker defibrillator point of view,
Right.
from an artificial heart point of view, and a prevention point of view. I say this is a good time to be alive from a cardiac standpoint, because so much we can do to prevent, treat, and get the life go longer with a good quality of life. Eat right, exercise,
True.
keep your cholesterol down, keep your blood sugar down. So those you're supposed to do it anyway. I'm board certified in heart failure and transplantation. That's my field of interest. So the artificial hearts, when I was a fellow in the late 90s, there was a big machine person has to carry when there is an artificial heart. Now people are going everywhere with the artificial heart. It's like almost like that big of a artificial heart.
And as a cardiologist, as a doctor, I think this is a 24 hours job, right? You're on call and you have to run around, outpatient, inpatient, surgeries, a lot of different things, I understand. So how do you manage, how do you balance your profession and your family? I know you take care of your family so well, and you've got 2 kids, and I think Nikhil is in medicine, right? He goes to school medicine. How are we able to balance so many things?
I think with a group practice, so that is the beauty of, when I'm on call 24 hours.
Okay.
But when I'm not on call, one of my partners will be taking care of the patient. So for those 2 days, I can be off and they can do other activities. I enjoy doing, either free clinic or going to a health fair or going to the community meeting. I enjoy it. I do it for myself. So I think the medicine is important, family is important, and other activities are important. So.
Yeah, like definitely. I think you said everything, but tell me the list of your hobbies or interests. I see you traveling again. I see community services. Just why didn't you list out all of them?
And from a medical point of view, I enjoy
Conventions.
volunteering in the hospital clinic. We work. I think we have a GAPI volunteer clinic in Global Mall. I started when I was a GAPI president about 2010.
Correct.
So we do it twice a week. First and the third Thursday of each week between 1 and 4. In fact, yesterday I was there in the afternoon to see uninsured patients. So especially when our Indian community people, when they come from India, so they're nice to have
You don't have insurance and stuff, right?
just to get the treatment. And then the health fairs is one. In the meantime, I think travel with the family. That's almost
Exactly.
every year I take at least one vacation. So that you need to recharge ourselves. So when you work harder, I think you at the same time I take enough vacation so that I can recharge myself, so that when I enjoy what I do. Even I work for 14-15 hours a day. When I go home, I still have energy. I can still go for a walk with my wife, and when the kids are there, I take them. So we go out, so that's our family time. So when we go on vacation, that's a good recharging. At the same time, when I go to India,
Exactly.
so I do both education part. Every time when I go for 2 to 3 weeks, I do part of it for education. Last time when I went to my medical college and did a talk about the heart failure.
Good.
I also went to my school, residential school, Surville, and I had a meeting. That was an outgoing, day. So I went and talked to the kids and just to help them out to see, and got some scholarships started so that they will have a motivation to do it. And then I took my parents to Rajasthan so that I can spend time with them for a week. So it's like a both. I think you need to balance it out. I think life, you never know what's going to happen tomorrow. My philosophy is live for today and then do the best you can.
Sure. Before we conclude, look into the camera and then straight tell our viewers, boom, 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 this is what you need to do. Okay, without this one, you are in trouble. So can you do that way? People will have this as a takeaway.
Southeast Asians or Indian Americans have a 3 to 5 times more heart disease than any other population. So I think we need to take care of ourselves. So eat right, exercise, and get some testing done, especially either calcium score, which will tell you if there is a blockage there or not. And if there is symptom, tightness, pressure, heaviness, please go see a doctor. Don't ignore. If there is exertional chest pain, exertional shortness of breath, please go see your doctor and get regular physicals and get regular checkups so that you know that what your cholesterol is, what your blood sugar is. You don't want to wait too long and then have a problem. So please take care of yourself by doing the risk factor modification.
This is one of my favorite questions. I ask this, I think, almost everyone, and it will be a favorite for you too. Can you recollect one single moment that give you immense pleasure or satisfaction or gratification?
One incident, one of my patients who I followed for almost 15 years, he passed away last year at the age of 85 with cancer.
Oh.
But before he passed away, he called me into the room and kept asking me, where did you go to school? So I said, so why do you want to know? He said, no, I want to give some money to you for your schools and whatever you want to do to educate better doctors like you. Eventually, he gave me a check for $100,000
Oh my God.
for helping and to get the doctors produced. I think what I would like to do with that money right now is to get the scholarships to the students and also get some educational funding so that both from my medical college as well as from my residential school, Surville. So I'm planning on getting the money to India so that I can help the people according to his wishes. That gave me a lot of happiness.
This sounds like the stories that we used to read in Chicken Soup for Soul. Thank you, Dr. Gangasani. Thanks for joining this as well as sharing so much information which otherwise we have to really watch so many different YouTube videos to really figure out, but we put everything into one. And thank you so much.
Thank you, Viju.